The most important cancer warning symptoms you must not ignore. Every single day across the globe, countless individuals grapple with a persistent unease. They experience a symptom, a nagging change in their body that has been bothering them for weeks, sometimes even months. The internal monologue often begins with rationalizations. It's probably nothing serious. I'm just too busy to deal with this right now, or surely it will simply disappear on its own. And to be fair, sometimes these instincts are correct. Minor ailments often resolve themselves without medical intervention. However, there are those other times, the times that loom large in the minds of medical professionals like me, keeping us awake at night. These are the instances when that seemingly innocuous symptom is, in fact, far from nothing. The critical window of opportunity, the stark difference between catching something early and discovering it late, can genuinely mean the difference between prolonged life and a premature death. This isn't shared to induce panic, but rather to underscore a profound truth. You deserve to be armed with the knowledge of precisely what your doctor is trained to look for, the genuine warning signs that necessitate urgent attention. Having dedicated nearly a decade to working in the demanding environment of NHS emergency departments, some of the busiest accident and emergency units in the country, I've witnessed this spectrum firsthand. I've encountered patients who presented with what appeared to be minor complaints, only for those symptoms to reveal a truly serious underlying condition upon further investigation. Equally, and perhaps more tragically, I've seen individuals who waited far too long to seek help simply because they were unaware of the crucial early indicators. My aim today is to empower you with truly invaluable information, the precise red flags that doctors are rigorously trained to act upon, directly from the National Institute for Health and Care Excellence, NICE. NICE is the authoritative body responsible for establishing the clinical guidelines that general practitioners and hospital doctors throughout the UK adhere to. These guidelines meticulously detail specific symptoms, crucial combinations of symptoms, and the particular age thresholds at which certain presentations become acutely urgent. My sincere hope is that you internalize this knowledge because, quite literally, it represents the most effective early warning system you possess. Let us begin by discussing colorectal cancer, often referred to as bowel cancer, which originates in the large bowel. This is one of the most prevalent cancers in the UK, and notably, the NICE guidance surrounding it is remarkably specific regarding both age and symptom presentation. Colorectal cancer manifests either in the colon or the rectum, parts of the large intestine, and currently stands as the fourth most common cancer across the UK population. The truly frustrating aspect of bowel cancer is its often insidious nature in the early stages. It frequently fails to produce dramatic or overt symptoms. Its initial manifestations can be incredibly subtle, which is precisely why individuals are prone to dismissing them as minor or temporary discomforts. However, this is where your focused attention becomes paramount, as I will now highlight the combinations of symptoms that the NICE guidelines specifically emphasize as urgent. If you are over the age of 40 and experiencing unexplained weight loss coupled with persistent abdominal pain, this warrants immediate and urgent investigation. It's crucial to distinguish this from weight loss due to conscious dietary changes, increased physical activity, or known medical conditions. This refers to a genuine, unbidden reduction in weight. Similarly, if you are 50 years of age or older and encounter unexplained rectal bleeding, meaning blood observed from your back passage for which no other definitive cause, such as hemorrhoids or piles, has been identified by a doctor, this situation mandates an urgent 2-week weight referral without exception. Furthermore, for individuals age 60 or above, the presence of either iron deficiency anemia without an obvious cause or a persistent change in bowel habits demands urgent assessment. A persistent change in bowel habits could manifest as going to the toilet significantly more often or less often, or a noticeable alteration in the consistency of your stools. For younger individuals under 50, rectal bleeding, when combined with any of the following: abdominal pain, an altered bowel habit, unexplained weight loss, or iron deficiency anemia also requires serious consideration and prompt investigation. The singular overarching keyword connecting all these scenarios is unexplained. If your GP has already diagnosed and treated your bleeding as, for instance, a hemorrhoid, that is a different context. However, new, persistent, and unexplained symptoms, particularly when they present in these specified combinations, necessitate decisive action. Moving on, let's address lung cancer. It's a common misconception that this is exclusively a smoker's disease, and I must interject here. While smoking remains overwhelmingly the single largest risk factor, and indeed significantly the biggest, lung cancer regrettably also affects non-smokers. Crucially, the symptoms remain consistent regardless of smoking history. Lung cancer tragically accounts for the most cancer-related deaths in the UK. A significant challenge in its early detection is that it frequently does not produce noticeable symptoms until it has progressed to a more advanced stage, which powerfully underscores the importance of recognizing the early warning signs. The NICE guidelines offer unambiguous clarity in this area. A persistent cough that lasts for more than 3 to 6 weeks, especially if it is a new cough for you or has fundamentally changed in its character, must be thoroughly investigated. This is not the transient cough associated with a common cold that eventually clears up, nor merely an irritating tickly throat, but rather an unyielding, unexplained cough. The next critical red flag is hemoptysis, which is the medical term for coughing up blood. This symptom, regardless of the quantity, even the smallest streaks of blood visible in your mucus when you cough, constitutes an urgent red flag and requires immediate medical attention. Additionally, if you experience new or worsening shortness of breath or unexplained chest pain, these could potentially indicate a serious condition, such as a blood clot in the lung, necessitating an immediate visit to the hospital. Other persistent symptoms, such as new or worsening breathlessness, unexplained chest symptoms, or unexplained fatigue or weight loss, are specifically identified by NICE as requiring GPs to arrange a chest X-ray within 2 weeks. It is paramount that if you experience any of these symptoms, and particularly if you are a smoker, you adopt an even more proactive approach to securing that medical appointment. Next on our vital list, and this point truly applies to everyone, without exception, is breast cancer. While it predominantly affects women, it is crucial to remember that men can also develop breast cancer. In fact, male breast cancer is often diagnosed at a later stage precisely because men frequently do not consider themselves at risk and therefore do not perform regular self-checks. Overall, breast cancer holds the unfortunate distinction of being the most common cancer in the UK, although it is not the most common cause of cancer death. The reassuring news, however, is that when breast cancer is detected early, the outcomes for treatment and recovery are generally very positive. This fact highlights why knowing what to look for is so profoundly important in this context. The primary red flag is the discovery of a new, unexplained lump or mass within the breast tissue. This refers to something that was not present before, that persists beyond any normal cyclical changes, such as those related to a menstrual cycle, and that you can feel but cannot rationally explain. Alongside a new lump, doctors also pay close attention to changes in the skin of the breast. These can include puckering or dimpling, redness, or a noticeable alteration in skin texture that might resemble the surface of an orange peel. Nipple changes are equally important, particularly new inversion, where the nipple begins to turn inward when it previously did not, or any unexplained nipple discharge. Furthermore, unexplained swelling in the armpit is also considered a red flag, as this is the location of the lymph nodes that drain the breast. In standard clinical practice within the UK, most GP pathways will fast-track investigations for any individual over the age of 30 who presents with an unexplained breast lump. But the core, overarching message is this: if you discover anything new and persistent in your breast that you simply cannot explain, At any age, you must consult your doctor without delay. Make it a routine practice to check your breasts regularly. This familiarity will enable you to promptly notice when something changes from your personal normal. The subsequent warning sign is profoundly important, yet regrettably, it remains significantly underappreciated. Please pay very close attention as we discuss ovarian cancer. This particular cancer resonates deeply with me, partly because it has earned a reputation, and in some respects a deserved one, for being a silent killer. I have personally witnessed several cases over my years in practice. Ovarian cancer is frequently diagnosed at a more advanced stage, precisely because its initial symptoms can be vague, easily dismissed, or attributed to other, less serious conditions. Indeed, it is not uncommon for women to spend months being told their symptoms are indicative of irritable bowel syndrome, IBS, stress, or general digestive issues before a proper and thorough investigation is finally initiated. There are 4 key symptoms that everyone should be aware of regarding ovarian cancer. Firstly, persistent bloating. This is not the temporary distension you might experience after a large meal, but rather an ongoing, unresolving bloating sensation. Secondly, feeling full quickly when eating, or experiencing a new and unexplained loss of appetite. Thirdly, persistent pelvic or abdominal pain. And fourthly, urinary symptoms, such as needing to go to the toilet more urgently or more frequently than what is normal for you. While any one of these symptoms in isolation can certainly be caused by completely benign conditions, their significance shifts dramatically if they are persistent, if they occur regularly. NICE frequently references a frequency of more than 12 times a month as a benchmark, and critically, if they are new and remain unexplained. In such circumstances, your doctor should arrange for a CA-125 blood test, followed by an urgent ultrasound scan. It's important to note that the risk of ovarian cancer substantially increases after the age of 50, particularly following menopause. However, it absolutely can affect younger women too, as I have personally observed. Therefore, please do not dismiss these symptoms as merely your stomach or hormonal changes without seeking professional medical evaluation. From this next section, I want you to commit one singular, vital piece of information to memory. If you ever observe blood in your urine, you must see your GP. Here, we are discussing bladder and other urological cancers. The headline symptom for these is hematuria, which is the medical term for blood in your urine. If you detect blood in your urine and there is no obvious, immediately apparent explanation for its presence, this necessitates urgent assessment. The appearance of the blood can vary. It might be pink, vividly red, or even a dark brown hue. It is important to clarify that this does not definitively mean cancer. There are numerous other potential causes, including urinary tract infections, kidney stones, and other benign conditions. However, visible, unexplained blood in your urine is always a red flag and mandates investigation, irrespective of your age. NICE is unequivocally clear on this point. Beyond visible hematuria, other changes in your urinary flow, new and unexplained urinary frequency, or any other urinary symptoms in individuals with significant risk factors, particularly smoking, given its substantial link to bladder cancer risk, all require prompt assessment. Older age further increases the urgency of investigation when these symptoms are present. If you observe blood in your urine and lack a clear explanation, such as a known and treated UTI, please book an urgent doctor's appointment without hesitation. Our next topic focuses on skin cancer. What makes this area particularly interesting is the unique opportunity it presents for early detection, simply by being aware of what to look for. The most serious form of skin cancer is melanoma. While it is not the most common type of skin cancer, it is undoubtedly the most dangerous due to its potential for rapid spread if not identified and treated early. The encouraging news, however, is that if melanoma is caught in its early stages, it is highly treatable. The ABCDE rule is the universally recognized mnemonic you should apply when examining moles or any suspicious skin lesions for potential melanomas. A stands for asymmetry, meaning one half of the mole does not mirror the other half. B is for border, referring to irregularity, where the edges of the mole appear ragged, notched, or blurred rather than smooth. C signifies color, specifically color variation, where you observe different shades of brown, black, or even areas of red or white within the same lesion. D denotes diameter, indicating a mole that is increasing in size over time. And finally, E represents evolution, which encompasses any change in the mole's size, shape, color, or the development of new symptoms such as bleeding, itching, or crusting. A new mole that is growing, changing, or simply looks distinctly different from your other moles requires professional assessment. Beyond melanoma, it is also important to be aware of other types of skin cancers. Therefore, any sore or ulcer on the skin that fails to heal after several weeks, especially if it is located on sun-exposed areas of the body, also warrants medical examination. Now let's turn our attention to blood cancers, which encompass leukemia, lymphoma, and myeloma. These are cancers affecting the blood itself and the lymphatic system. The symptoms associated with these conditions can be quite varied and often non-specific, which contributes to the diagnostic challenge they present. However, there are several key indicators that you should be vigilant for. Firstly, persistent, unexplained fatigue that goes far beyond normal tiredness. This isn't just feeling sleepy, it's the kind of profound exhaustion where you're getting adequate sleep but still feel utterly drained and lacking energy. Secondly, unexplained pallor, meaning you appear unusually pale more often than is normal for you. Thirdly, a persistent and unexplained fever or night sweat so severe that you wake up drenched in sweat. Fourthly, recurrent infections, or infections that are notably more severe or prolonged than you would typically expect. This can be a crucial sign that the immune system is not functioning effectively. Fifthly, unexplained bruising or bleeding, such as bruises appearing without any discernible injury, or bleeding that takes an abnormally long time to cease. Another significant red flag is swollen lymph nodes. While we briefly touched on this in the context of breast cancer, it holds particular importance here. You might notice persistent lumps in areas like your neck, armpits, or groin. Crucially, these swollen lymph nodes are often painless in blood cancers, which can lead to delayed investigation, as pain is often the trigger for seeking medical help. And in some instances, individuals may experience a feeling of fullness or discomfort in the abdomen, which can be caused by an enlarged spleen or liver. Any of these symptoms, and especially their occurrence in combination, warrants urgent blood tests, particularly a full blood count. Your GP can typically arrange this within a day or two. If that is not possible, or if symptoms are rapidly worsening, attending an A&E department is appropriate. The next category demands your careful consideration, as its symptoms can be remarkably easy to dismiss or attribute to entirely different, less serious causes. We are talking about brain and central nervous system cancers. While these are relatively rare, their seriousness is undeniable, and the specific symptoms are directly influenced by the precise location within the brain where a tumor might be developing. The paramount red flag here is progression. These are symptoms that are consistently worsening over time, rather than remaining stable or showing signs of improvement. The NICE guidance specifically highlights a progressive neurological deficit. This could manifest as weakness on one side of the body that is noticeably getting worse, developing problems with coordination, new disturbances in vision, new difficulties with speech, or new cognitive changes such as memory impairment or alterations in personality. Persistent, severe headaches also warrant serious attention, particularly if they are worse in the morning, if they are severe enough to wake someone from sleep, or if they are accompanied by vomiting. While it is certainly true that the vast majority of headaches are not indicative of brain tumors, a headache that is genuinely new for you, persistent, progressively worsening, and cannot be explained by other common causes, especially when accompanied by any of the other neurological symptoms I've just listed, absolutely needs to be investigated with a scan of the head. Adults exhibiting progressive neurological symptoms should be seen urgently by a medical professional. In the case of children and young people presenting with new, abnormal neurological signs, such a referral should ideally occur within 1 or 2 days. Here is a type of cancer that many people have never heard of, and I believe this lack of awareness is part of the problem. This section focuses on sarcomas. These are cancers of the body's connective tissues, which include muscle, bones, nerves, and fat. They are less common than many of the other cancers we have discussed, but they do occur and can be highly aggressive. The key red flag for sarcomas is actually quite straightforward: an unexplained lump anywhere on the body that is noticeably growing. This is especially concerning if the lump feels deep to the skin, meaning it appears to sit below the surface rather than directly within the skin itself. Furthermore, particular emphasis is placed on lumps larger than 5 centimeters, and those that feel firm or hard to the touch. Any lump you discover that is consistently increasing in size over a period of weeks to months, and for which you cannot provide a logical explanation, requires assessment, typically with an ultrasound scan and potentially an urgent referral to a specialist. This guidance extends equally to children and young people, where suspicious lumps necessitate very urgent investigation. It is a dangerous assumption to believe that because a lump is painless, it must be benign. Many sarcomas in their early stages cause no pain whatsoever. Finally, there is a symptom that might initially seem vague, but which is, in fact, one of the most critically important flags on this entire list: unexplained weight loss. I've touched upon this briefly in the context of specific cancers, but let's revisit it as a standalone, overarching warning. If you have experienced a significant amount of weight loss without actively trying to lose weight, meaning without intentional changes to your diet or exercise routine, and without another clear medical explanation, and this weight loss is persistent, it absolutely demands investigation. Numerous different types of cancer can manifest unexplained weight loss as one of their initial symptoms. NICE, the National Institute for Health and Care Excellence, is unequivocal in stating that unexplained weight loss, even in isolation, warrants urgent investigation. This is true even when there isn't another obvious, localizing symptom pointing towards a specific organ or part of the body. Do not dismiss this symptom as simply stress or an inevitable consequence of getting older. Pick up the phone and ring your GP to get it checked. To bring all this crucial information together, I want to leave you with something truly actionable, recognizing that this has been a substantial amount of information. The consistent, unifying theme threading through every single one of these warning signs is the word unexplained. We are talking about symptoms that are new to you, that are persistent, generally lasting for weeks rather than just a few days, that lack an obvious, already established reason for their presence, and that are not improving with simple, self-managed measures. That is the critical juncture when you must act. And acting means proactively booking an urgent appointment with your GP. It doesn't necessarily mean rushing to A&E unless your symptoms are acutely dangerous or life-threatening. Your GP is your primary gateway to all the necessary referral pathways, diagnostic tests, and investigations. I completely understand the frustration and difficulty often associated with securing a GP appointment in today's healthcare landscape, but I implore you, be persistent. When you do speak to the receptionist or doctor, explicitly mention the specific red flags that you recognize from this information. Hopefully, this will ensure you are seen sooner rather than later. Let me reiterate this one more time, because its significance cannot be overstated. Early detection saves lives. This is not some vague, abstract concept. It is a very real, measurable, and profoundly significant truth. For most of these cancers, the difference in survival rates between an early-stage diagnosis and a late-stage diagnosis can very often span decades. Your vigilance and proactive approach could genuinely be the key to a longer, healthier life.